As of 7th March 2020, coronavirus has so far spread to 92 countries, of which 8 are on the African continent. 101,828 cases have been reported globally, while the deaths stand at 3,483. Now, in a bid to further protect the country from a possible outbreak, the Ministry of Health has reviewed the global outbreaks with the objective of identifying the most affected countries. After this exercise, countries affected by coronavirus have been put into 3 categories. The first category includes countries that have the highest number of confirmed cases, and these include Italy, Iran, South Korea, France, China, Germany and Spain. Nationals and Ugandans staying in these countries have been advised to hold off on traveling to Uganda unless absolutely necessary.
Individuals highlighted in this category 1 who insist on visiting Uganda will be subjected to self-isolation or institutional isolation at their own cost.
The second category has countries whose confirmed cases are still low, and these include America, United Kingdom, Switzerland, Norway, Netherlands, Sweden, Belgium and India.
The Ministry of Health will observe the travelers very closely and the evolution of the outbreak in these countries and advise on any restrictions in the coming weeks.
Travelers from countries that have not been put in these categories will undergo regular screening processes. This move has been supported by the World Health Organization, which notes that majority of the infections are due to travel, where infections have been reported.
Almost all countries have as an initial connection to the initial infection in the first country. So almost all countries has their first cases imported.
In addition to this, the ministry has also placed restrictions on mass gatherings, including religious events, sports events like football matches, social culture events like weddings and funerals, as well as political and national events like rallies.
The organizers should designate a competent person to liaise with the health authorities for advice during organization of events. Number 2, ensure provision of adequate hand-washing facilities with soap and water or alcohol-based hand rub.
More isolation facilities are also being put in place across the country to handle patients in the event of an outbreak.
We are preparing Mulago Specialized Hospital so that we can isolate cases there in the event of an outbreak that occurs in the country.
The Ministry of Health is now awaiting a further 20 billion shillings from the Finance Ministry to boost its preparations. Joyce Nakato, NTV Weekend Edition.